Time now to talk the politics and policy of healthcare. I'm joined by Arkansas Surgeon General Greg Bledsoe and Arkansas Health Insurance Marketplace Director Cheryl Gardner. Welcome to both of you. Thanks for being here.
having us.
All right, so there's just been a little bit happening on the healthcare front, pretty much all year, but I mean it has really ramped up a lot lately. And so Cheryl, I want to come to you first and talk about something. We're all in a little bit of an enrollment period or looking at some plans for next year in the SHOP program for small businesses. Tell me a little bit about why it has been successful and why it hasn't experienced some of the cost overruns like maybe some other things that we've read about in the newspaper.
So thank you. Well, it's been a great launch. We were successful. In fact, we were actually able to launch ahead of schedule, which is a completely different story than you read about in most other states or even at the federal level. We were very careful about the way we contracted. These were all fixed price contracts and they were deliverable space. So we don't pay for functionality until we get functionality, and amazingly enough, that works as a marvelous motivator for your vendors.
Enrollment has been good?
We won't know final enrollment numbers until early next month, but we've seen a lot of activity on the website, and we think that there's an ease of use that makes this really appealing to businesses and brokers.
All right, I'm going to just kind of flip around to another healthcare topic here so I can pull Greg in on this one here.
Sure.
We have seen the legislative task force really ramp up a lot in the last couple of weeks here. They seem to be centering on some solutions. What do you think will be, I guess, can you look a little bit into the crystal ball now and see a path of where we're going?
Well, I think the good thing about the task force is that we've had everything on the table. So all the major health reform possibilities have been discussed. I do hear a lot about expanding episodes of care and the patient-centered medical homes. There's some discussion about managed care. There's some discussion about combining the 1115 and the 1332 waivers to get more flexibility from the federal government. And I think you're going to have a continuation of this discussion up until the votes later this month, and we'll just see what happens.
Let's talk about those 1332 and 1115 waivers. Senator David Sanders actually sent a letter to your Health Insurance Marketplace Board asking your consultants, PCG, to look at a couple things tied to those waivers. What do you think he's driving at, and what do you think are the biggest answers that need to be achieved?
Well, I think he's looking at lots of what's coming out of the executive branch, some of the discussions in the task force, and some of the things now that we have this viable option that is this insurance exchange, the small business exchange. How can we leverage the functionality of that exchange to best serve Arkansans? And you know, there were a few specific policy options that could be exacted under a combination 1115, 1332 waiver that he asked us to look at. Probably top of that list is using premium tax credits on the small employer side as opposed to on the individual side. And if there's a fatal flaw to the Affordable Care Act, it's that it didn't leverage what employers were willing to do for their employees anyway.
Yeah, Greg, you have conversations with the federal government all the time, and so I'm sure you're going to want to reveal all of those conversations with us right now in this interview. But what do you think is the temperature of the federal government in terms of the HHS?
Well, it's difficult to say. We entered this with the hope that we would be getting maximum flexibility from the federal government. Those talks are continuing. There's still the hope that we're going to get flexibility. But to go back to your question to Cheryl, I think what Senator Sanders is asking for is the same thing that every legislator in Arkansas is asking for, which is maximum flexibility for our state. The problem with the Affordable Care Act, as I see it, is it's a one-size-fits-all program for the entire country. And so what we're trying to do with our reform efforts is carve out a niche that works for Arkansas and get as much flexibility there for our people as we can.
Managed care, a big part of that? I mean, is it inevitable?
Well,
there seems to be consensus moving in that direction.
There is some discussion on managed care, and what I would say with managed care is no one is looking at managed care for the entire Medicaid population. But for the high-cost populations like developmental disability, long-term care, behavioral health, it's certainly on the table. But you know, when you look at managed care, I don't see anyone pushing it as their first choice, but what I tell people is it might be the inevitable choice if we can't get other reforms in those spaces. So it's being discussed. We'll have to see what happens, though.
All right. Cheryl gets the difficult question first here, and that is, at the end of December, we will have task force recommendations on the table to the governor. We'll be closer to closing the enrollment period with SHOP. You'll see more activity in that respect. What do you think and we'll have answers maybe from your consultant group here on this stuff. What's the headline going to be at the end of December about healthcare in Arkansas?
The headline will be, once again, Arkansas out in front on health system reform.
Oh, all right. Greg, you?
I think it's going to be health reform succeeds, but maybe not everyone happy.
I think it's going to be journalists like Roby Brogg have a lot to continue to report on in 2016. So, all right, Greg Bledsoe, Cheryl Gardner, thank you both for being here. Appreciate you
Roby.
very much.
Thank you very much.